Greetings, welcome to my channel, The Craftswoman. Today we have a special guest today. I want to introduce to you Mrs. Peta. She is a recent graduate of the Craftswoman Online Doula Training Program. And we want to just have a conversation today about what she has to offer, how she's going to positively affect the birth community. So thank you so much for joining me, Sister Peta.
Thank you for having me, Abina.
Okay, so the first thing I want to ask you is, why did you want to become a doula?
Well, I really wanted to become a doula because every birthing experience that I've had has been different. With my second child, it was a complete mess. I could tell that the doctors weren't really invested in me. I could also tell that, they really didn't care about my needs. And so when I passed out with my second daughter, ended up vomiting my bowels, and no one rushed to my aid. And so I knew at that
point. When did you pass out?
I passed out right before the delivery. I had kept telling the doctors and the nurses that I feel like I was ready to go, and they kept telling me that I had to wait until the shift changed because I was inside of a military hospital.
Wow.
Yeah, so that was a traumatic experience for me. So my friend, she was there, and I said, hey, put my leg on this little thing. We're going to push this baby out. And that's what I did.
So you basically delivered on your own with nobody there?
I basically delivered on my own. By the time the nurses and the doctors got in there, she was already crowned. I had already split, all of that good stuff.
Wow. Did you tear?
Yes, I tore tremendously.
So you didn't have any medication? You weren't on any medication?
They didn't get the medication to me in time. Everything happened so quickly. So they weren't able to get the medication to me in time. And I believe that's why, the situation happened like that, because it was so much pain and I didn't know what to expect. I didn't have any type of sedation. I didn't have anything to calm me down. I'm in this room, with my friend. She don't know what's going on. She's just there for moral support, and so I believe that's what caused that. So with my third baby, my last baby here, I went into the hospital with a birthing plan. I didn't even go to the military installation anymore because they were trying to force me into a flu vaccination, which I refused vaccines due to, my recent history with vaccinations. And so because I didn't get the vaccinations, they wanted to delay me knowing the gender of my child. And I was like, oh no. Wow. I want to be back here,
That seems like a little punishment or something.
It was, because at the time, coming out of the military, so they feel like, oh, you're used to this harsh treatment. So they don't really treat you, like a human being. They treat you like a number when you're in the military. And so because of that, I started researching doulas, and I was looking all around Central Texas trying to find me a doula. And then I started getting into all these videos and all of that. And I was like, I could do this stuff myself, And so with my last child, we pretty much had a birthing plan. We controlled the entire delivery all the way down to the delayed clamping. They even use the heart rate is going up and you need to get a cesarean after 18 hours of labor. And I'm like, no, we're going to do it my way. And
so it was you didn't get any medication during the third pregnancy?
So they ended up giving me, what is that stuff called? Pitocin?
Yeah.
They gave me the Pitocin. And so when they gave me the Pitocin, they stripped my membrane and all of this other stuff that wasn't a part of the plan.
During the third labor?
Yeah, during the third labor. And so they ended up doing that because I guess I was laboring too long for them. And so they ended up giving me that, which if I know what I knew now, I wouldn't have got it, because my baby, he came out, he was just so like, I don't know what he was on, but he was on cloud 9, so I did get that. And because I had degenerative spine disease, the epidural, they tried to inject the epidural in me, missed, and my legs, not my other leg, just one leg and one arm went numb, and yeah.
Wow.
So yeah.
That's something else. So you did delayed cord clamping?
I did.
And what did you do with your placenta?
So I wanted to take my placenta home, but that would have been an additional fee. So what I did was, yeah, it would have been an additional fee. And during that time, I was in a transition between the military insurance and my retirement insurance, combining it with my husband. And so I couldn't afford at that time bringing a new child into the world, the cost of what the placenta would have been. I also tried to get them to store the cord blood, and they were saying that that was going to cost me $2,700. So I'm like, you know what? We just gonna go forward with the delayed clamping. So what I did was I did the delayed clamping. And when you're doing delayed clamping inside of a birthing center, you have like all of these different regulations, especially
Wait a minute. You delivered at a birthing center?
not a birthing center, but a birthing hospital. So
Okay.
it's a hospital, but my doctor, he works out of a clinic, and he was authorized to deliver babies inside of this hospital, this particular hospital.
Okay.
And so we did delayed clamping, and it's different regulations. He wanted to do 1 minute because of the American Academy, not American Academy of Pediatrics, but the American College of Obstetrician and Gynecology. They don't want you to do more than 30 seconds to a minute of delayed clamping. And then, American Association of Pediatrics, they want you to do 1, but WHO allows you to do 3. And so since the WHO organization allows you to do 3 minutes of delayed clamping, we ended up delaying the clamping of the placenta for 5 minutes. So we even pushed it, me and my husband, we pushed it to 5 minutes. That way that placenta could stop pulsing, because those first initial pulses, that's when the baby can get all of the minerals from all the oxygen, all the minerals from the cord. So that's how we did it.
And you breastfed your baby?
I did.
And how long did you breastfeed? Or are you still breastfeeding?
Well, with this baby, I breastfed him for 3 months because he went to Haiti and got a hold of some rice and beans, and that was it. So.
Oh, wow. Okay.
Yeah. So, but he still got breast milk as far as, but he was already eating his rice, his beans, his mushy foods, and I would mix the breast milk.
At 3 months?
At 3 months.
Wow. Okay. Yep. 3 months.
Yeah.
Okay. So how do you feel like you having a doula by your side would have changed your birth experiences?
Oh, so with my kids, I feel like having a doula by my side would have been even more powerful. The power and the strength that I had on the third child, I didn't have that with the other children. And so if I had that advocate there, they could have really enforced. But especially like with me passing out and getting weak and trying to push and trying to do all of this stuff, it's like you can't really focus on all the things that you need to do. So having my husband there, ensuring that, like, my husband was my doula. He knew the plan. He was making sure that they didn't prick my baby with these vaccines. They couldn't even take my baby out of the room. They did the PKU checks in the hallway so that he can be able to observe, so having him being my advocate during that whole time, I was like, oh, you know what? Had I had this type of support in the beginning, then none of the other things that came along with those previous pregnancies would have happened. So.
Okay. So, with you becoming a doula, did you want to, well, you've already had your birth experiences. You want to share how that went, your birth?
Well, with the birthing experience since the COVID, I had to watch another doula deliver a baby in another state. So the
mom was a doula?
No, it was the mom had a midwife and a doula, and I had to watch a doula because she wanted someone present.
Okay.
And so she was able to do it at the birthing center, and that doula ended up calling me. So it was like I was the primary doula for the friend, but I was also the secondary doula because I wasn't really physically doing anything. But the experience, it happened so fast, and the team was amazing.
They
You know,
let her videotape like the whole thing.
they let her videotape the whole thing because that was in her birthing plan that I needed to be contacted.
Oh wow.
Yeah, so that way, whenever they did something, I'm making sure that, hey, they're doing it right. You know, that they're not trying to rush her through her birthing process.
So during COVID, people still can get doulas,
Yes,
even virtually and physically. Wow,
yes.
that was amazing.
The birthing center is like the best bet for the doula. When you know, like if you want to deliver babies for all moms, the birthing centers to me would be the best bet, or doing an at-home birth. And the reason why I say the birthing center is because, you know, it's not that whole rush of cycling patients through to get them out because of COVID. Then the baby is not as vulnerable because you're around, you know, you're around just people that you know, and then you don't run the risk of them trying to rush these vaccines down your baby, you know, and causing further damage. Because with my kids, I do not vaccinate them. We use alternative medication in order to, you know, make sure that they're protected from different types of viruses.
So
And
how have you been able to travel outside the country? And I don't know if you homeschool. Do you how or daycare? Like how have you been able to go through? Because a lot of people feel like you have to have vaccinations to travel when there are exemptions, and you
oh,
also they think that you have to have vaccinations to put your children in public schools or daycares when there are some exemptions.
oh no, we got a vaccine exemption form. Every state should have them. We got the vaccine exemption forms. They're notarized. It looks just like a birth certificate that no one could, you know, vaccinate us or our children because of our philosophical reasoning is what they call it, or some would say religious preference. And because we're naturalists, we just don't put those different type of toxins into our children because they don't need them. But we've been able to travel all around the world. My little baby has 3 passport stamps, so he's been to different countries. None of my children have had any trouble flying. I've never had trouble flying. I was exempt from vaccinations throughout my entire military career except for the first year. So it is possible, it can be done. You just got to stand strong on your reasoning behind it.
Wow, that is so great. So I know that you already have a thriving channel. And by the way, I just started my Patreon, and
Right.
you are the reason why, because you told me to start that. So I'll be doing another video about, what to expect. So I know that you have, a thriving channel, and you do videos every single day, and you have herbs. Can you tell us about everything that you offer?
Yes. So with the doula program, I am wanting to work with the mom long term if possible. So as soon as they get pregnant, I would like for them to contact me. I want to do pregnancy, birth, and the postpartum. And the reason why I want to do the pregnancy as well is because moms, I don't want them to think that they have to be pressured into taking these, you know, vaccines or antibiotics or things like that their body does not need in order to make sure that this baby grow into a healthy baby. And so I have the herbs and all the different supplements that they can take for prenatal. I also have all the things that they can take afterwards and give their children. With this program that I offer, I am offering, you know, doula services, providing them with yoga, teaching them meditation techniques so that they could, you know, be able to calm their body. That way, when they transition into the labor, when they transition into it, they already understand the fundamentals of controlling their breathing and using their parasympathetic nervous system in order to help calm the body and calm the state of mind. Because that's like, to me, that is the most important part. Most people are used to using their symptomatic nervous system when they're exercising, so they get anxious. But this is just reprogramming the way that they're breathing in order to assist them in that transition. And then following that, once mom is into motherhood, you know, the baby blues, offering them little services so I can assist them around the home, as well as bringing them back to that state of mind, that state of normalizing their thought process and having this new individual into the home. So I provide coaching services for the mom. soon to be licensed in Central Texas to provide mental health for the mom. So
Oh,
they'll
wow.
be getting a full, this is long term. And then once they're, able to function and get back on their feet, then my role would pretty much be complete with the mom.
So that's for pregnancy and during birth and
Mm-hmm.
postpartum.
Mm-hmm.
So as you can see, like, we do have a birth crisis here in America. How
Mm-hmm.
do you feel that you can help, like, with that? Because I feel like, one person cannot do it all. So that's why it's important for us to share the information with other moms and with other people. How do you feel like we can help lower the infant and maternal mortality rate among Black women right now?
The way to lower it is the education. I feel like if a mom is educated on what's available to her, what resources that they have, if both parents understanding of that, then that can lower the infant mortality rate. Because here we are, we're in this pandemic, and we have this thing that is coming up against us. So now this is going to be the initial time that they're going to be like, oh, you need to get this vaccine. This is how you're going to protect your baby from COVID. And really, this is lessening the chance of your fetus surviving on the outside. So taking away all of that, teaching the moms, educating the moms on things that are available to them, how to boost their immune system during pregnancy, what vitamins, what supplements, what nutrients to give their body so that they can have a higher chance of, having a successful pregnancy. That way they don't fall into that, what are the norms? The pregnancy diabetes, the flu shot, so these are the things that they're trying to force on these moms, and these are the fears that these moms have. So just pretty much educating the moms, easing their mind, and providing them with the things that they need so that they can thrive, and also so their fetus could thrive. So yeah.
Okay. And what are your channels and your contact information? We're not finished, but I want to give that right now.
So my contact information is spiritsoulcoaching.net. That's my website, and that's where you can book your consultations and things like that, and then we can discuss your contract. We also have blenderroots.com. That's where you can receive all your supplements and things that you need for yourself and baby. And I'm also on Spirit Soul Oracle on Instagram.
Okay. Yeah. So did you say a YouTube channel?
Oh, my YouTube channel is Spirit Soul Energy Oracle.
Okay. And you do the readings and all that stuff?
The reading, pretty much wellness, anything wellness, mind, body, soul, coaching, whatever it is, whatever I feel like the world needs, I just put it out there.
And how did you get into herbs?
I got into herbs because on my transition out of the military, I had contracted typhoid type A overseas in Afghanistan. I ended up having a liver disease coming from that because it was in my body so long, it was breaking down my organs, had some kidney nephrosis, and then later diagnosed with fibromyalgia. And so this was this chronic pain, and they was giving me all of these different steroids, and the medication that they were giving me at the time was causing my brain to like forget what I was doing. And so my husband, who was my fiance at the time, we decided, we was like, there got to be another alternative. And so we really began to study the alchemy of all these herbs. And during this transition, we just learned a lot of different things about herbs. Secondly, once we began to try to conceive my son, I was told that I had endometriosis and that I wasn't going to be able to, have a child because my cervix was closed. Long story short, we got into these herbs. We figured out which herbs would work to remove this endometriosis out of the body, to extract it out. And then we were pregnant, and now we have this big, huge age gap in between the kids. So.
So can you just list some of the herbs that you sell that you'll be providing, or some of the things that can help people?
Okay. So one thing that you already know, my go-to, sea moss, because sea moss, this is the multivitamin. This is what the mom needs. This is actual real vitamin, not just a name to say that this is a vitamin. No, these are actual real minerals. 92 of the 102 minerals that your body needs to thrive, the sea moss can provide that. Also, we offer the olive leaf, and what the olive leaf does is this is the antibacterial, this is the antifungal, this is the antiviral. And so this is when, you know, when they say once you get the check and then the mom has the yeast infection, then they got to take the, no, you don't need that because you're already putting this into your body. We also offer spirulina, chlorella, who are the cousins to the sea moss. And what they do, they provide the body with collagen so that when you're trying to bounce back afterwards, it can help you bounce back. But not only that, that vitamin K that they say that your baby needs, when you're breastfeeding your baby, all of those minerals and all those nutrients are going right into the baby. And so it's going into you and it's also filtering into your baby. And the colloidal silver. As soon as the baby is born, 1 drop of colloidal silver goes on the baby's tongue. Now, the colloidal silver is used by the doctors for their eyes, right? To prevent any type of bacteria from damaging the baby's vision, right? So we take that same technique and we use that, this old Caribbean tradition, and we take that 1 drop and put it on the baby's tongue. It tastes like nothing. This is going to protect the baby against any bacteria, any viruses, any herpes, anything that could possibly come against this child during its infancy. So we have a lot to offer, but we also offer yoni steam herbs. We offer wellness teas, different type of wellness teas for the immune boosting system. So elderberry syrup, sambuca, is about to get cold around here. And you know, when the babies are younger, you can't really give them anything. We even have like baby creams and butters to provide the baby so that if they get any phlegm or inflammation or anything like that, then the moms could feel safe putting natural, non-chemical based products on their children.
So you have like things for the whole family.
The whole
Can
family.
someone contacted me about and asked me, can pregnant women take colloidal silver? I was like, I don't know.
Pregnant women can take colloidal silver.
Wow.
I took, the doctors, they advised against what I was taking, but I wasn't listening to that. And a lot of moms take it, especially when you're in this type of world, because you got to you got to try to prevent all those things that come on. So, you know, like when normally towards the end of the pregnancy where everyone gets sick, and I didn't have that, you know, and it just went on through my pregnancy, and I didn't get any illnesses, no bacteria, no yeast infections, none of those things that come along with the pregnancy.
Oh, wow. That's excellent to know that. And I remember you saying how, I know that like when you're breastfeeding, people, well, even I know an herbalist was trying to tell me I didn't need to take anything while I was breastfeeding. They say everything gets transferred to your baby, but you have like a different.
I have a different I have a different approach because I have this baby in there that is just thriving, never had any illnesses, body just functions in a way. Even the doctors, because of course we have to have a doctor that will see our child because of the state regulations. But even the doctor was like, you guys need to keep doing what you're doing because this baby is the healthiest little kid, you know?
And you still took herbs while you were breastfeeding?
Oh, yeah. And all of my children have been advanced. My daughter, she walked at 6.5 months. She took her first steps. She was fully walking by 7 months. My son, he's now 2. He know all of his ABCs. He can count to 20. He can count backwards, you know, so he know words. And so I attribute all of this to the vaccine, not giving them the vaccination that's slowing down that thought process, that's slowing down their cognitive functions. But, you know, there's some that love the vaccine, so I'm not against it. I'm just showing you ways to protect your babies if you decide otherwise.
Wow, that's amazing. Like all of this herbal knowledge, it's just so important because it's so many things that they tell you, well, it's not, they say that it's not pregnancy safe. Even some things, it's just so many contradicting things that you can see over the internet. And even just being, if you listen to like different medical providers, so many people are like against doing herbs while you're pregnant and while you're breastfeeding, but you are completely pure evidence that you can still do those things and still be fine and healthy. What are your recommendations for anyone who just found out that they are pregnant and maybe watching this video?
My recommendations for anybody that's pregnant and watching this video, just educate yourself. Always, even when someone tells you some information, it's best that you would go and do that research yourself, because you got to understand that the doctors, they get paid for every vaccine they give. They get paid for every surgery that they conduct. That's how they make their money.
Mm-hmm.
Or else it's just a salary. And so that's how Rockefeller makes his money. So of course they're telling these people, hey, tell them this, and hey, tell them that, and scare them with this. So I just feel like you should educate yourself so that you can feel more comfortable about whatever decisions that you're making. And that way fear doesn't set in. Because oftentimes what happens is the fear sets in, and then people get scared and they be like, oh, I'm gonna just go do back what I normally do, not thinking about the long-term ramifications of what they did. You see what I'm saying?
Right. And what about if someone is trying to get pregnant? What kind of advice do you have for them?
If someone is trying to get pregnant, clean your diet up. All right. It starts with nutrition. I've done the alkaline diet. I've done pescatarian, where I extracted all of things that was, pork based and beef based, and just did seafood and veggies. I've did vegan. You just got to clean your diet up. Increase that water intake. Moms do not know how important it is to drink water. I drink at least a gallon of water a day. I probably drank more when I was pregnant, but it's just getting that, increasing that water intake, because that's going to assist you in flushing your system and putting these natural detoxes in your body, like a lime. A lime not never hurt nobody. Just drop that lime into your water and help flush your system out. Using apple cider vinegar, just things like that to assist you. And then finding some natural herbs, doing your vaginal steams, that's going to assist you in, breaking down whatever's up in there, whether you have cysts, fibroids, all of these different things that are blocking you from being able to conceive, and just cleansing purifying your body of all that stuff. I guarantee you, unless you don't have a wound, or, something has cut something off and saying that you can't have kids, you can have kids, because my second child was 9 before the last child came. And this is from years of the doctors telling me that I can't conceive because of this. And here we got this little baby running around, proving to them, because they was getting ready to do my HCG test when I went in there and found out that it was a baby in there. And the HCG test is the little test that they test before they give you the hysterectomy. Wow. So, oh yeah, so it's possible. So just do your research. Don't listen to them, because everything about what they're telling you is a bottom line. All they're going to do is just take your little uterus out and sell it to somebody else. Just like when you don't do what you need to do for your placenta, they're going to go sell it on the black market for $50K so that they can break it down into some powders so that somebody else could live off of it. So just make sure you're just really, educating yourself on what's going on.
Man, this is so much good information. In what area are you serving your doula services?
So for 8 more months, well, I'm going to say 7 more months, I will be servicing the South Carolina area. But after that, I will be back in the Central Texas area servicing Austin, Killeen, Temple, and Georgetown.
Okay. And what was the reason? I don't know if I asked you this before, but I know I probably asked you this before, but I don't know if I asked you during this video because I have no notes. Why do you want to serve as military moms? I know that you specifically said that was a group that you wanted to cater to.
Yeah, military moms, because military moms face several challenges inside of their family system. So you may have a military mom whose husband is deployed, or whose significant other is deployed, and they don't have that support. So I could come in and be that advocate, because I understand the dual side of the spectrum. Here I am, retired military, staff sergeant in the United States Army, and now I'm on the other side facilitating wholeness and wellness. So I understand the challenges that a military mom could possibly be going through, especially during that critical point. Say for example, the husband on a deployment and he can only come home just for the baby's delivery, and then he has to go back overseas. So now mommy is here with this baby, and these things are picking up in her mind, you know, because she's there by herself. So this is going to not only help mom and baby, it's going to help daddy too, because daddy going to know that mom is taken care of by someone who understands the military to challenge the thoughts that mommy is having, you see? So yeah.
Oh, wow, that's so great. So we're going to end this wonderful video, and I want to make sure that you give all of your contact information again for your doula services, your videos. How can people contact you?
All righty. So if you want to contact me on the website, again, that's spiritsoulcoaching.net. On Instagram, I am Spirit Soul Oracle. And on YouTube, I'm Spirit Soul Energy Oracle. Also, if you need to just immediately contact me, my office number is 254-307-2320. That's 254-307-2320.
All right, thank you so much. And you all, please like, share, subscribe to this channel.
Yes.
Also, share this video. Please share this video. You can leave a comment or anything. We can both answer because you are subscribing to my channel too.
Yeah,
okay. So yeah, make sure that you all keep in contact with Sister Peta, because she has everything. She has everything you need, the whole coaching thing, the herbs, like all the knowledge, and she is a living example of what can be done. I mean, this is a positive example of for dealing with fertility issues and, you know, having multiple children, military mom, all of that good stuff. So you all, please, please, please stay in contact with Sister Peta, and we'll see you soon. Thank you for joining us, Sister Peta.
Peace.